This is Radio Health Journal. I'm Reed Pence. This week, reaching herd immunity. If reason won't get people vaccinated, maybe incentives will.
It will take a variety of different things to, in effect, give them a lollipop of some sort after they're vaccinated as an immediate reward.
The struggle for vaccine acceptance when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Change is what is wild about nature, and we should cherish that and look out for some of these incoming species, the go-getter colonists.
A different perspective on invasive species. Then,
I very often watch students speak and they lose control of their breath. And there's a difference between speaking from your diaphragm and speaking from your chest. And when you speak from your chest, you lose control of the force of your voice.
How do you feel about public speaking? I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
A year ago, when thousands of people were dying every day of COVID-19, America waited for vaccines that could end the nightmare. Now, more than half of American adults have been vaccinated, and mask restrictions are disappearing for fully vaccinated people. But even so, public health experts say that the end of the pandemic won't come soon, or maybe ever. We may never reach what used to be the goal, what's called herd immunity, the point where so many people are vaccinated that the virus stalls out.
The notion is that if sufficient people in the community are protected, either by vaccine or natural infection, the virus that's spreading will have a hard time finding new people to infect. So the transmission of this virus will be substantially diminished and the illness controlled.
That's Dr. William Schaffner, professor of preventive medicine and infectious diseases at Vanderbilt University. He says experts project we'll need to get about 80% of the population vaccinated to reach herd immunity. That's about 10% more than we imagined we'd need before the arrival of new strains of the virus.
The more contagious the virus, the higher the level in the community of protection that's required to create this inhibition of transmission. Once the variants came onto the scene, particularly that British variant, which is more contagious, the estimates, the back-of-the-envelope calculations about the proportion of the population that would need to be immune was increased.
Herd immunity can be a frustrating concept, that your choice of whether or not to get a COVID shot matters to more than just you. Your choice matters a lot to people with compromised immune systems, for whom vaccines don't provide complete protection. Public health experts have been surprised that we're likely to fall so far short of the threshold that would end the pandemic and open things back up completely for everyone.
We encountered the hesitant much sooner than we anticipated. We thought that as the age indication for the vaccine diminished, people would still come in. Well, the eager beavers seem to have been vaccinated, but there are still lots of hesitant people, and we're growing in appreciation that there are people out there in a considerable number who say, nope, I'm never going to get the vaccine, regardless of what you try to do to persuade me to receive it. So knowing that, I think people are saying, we may not get to 80%, but nonetheless, everybody who's vaccinated contributes somewhat, and we will get some diminution in viral transmission. But there may be communities, locations that have very low viral acceptance, and the virus will continue to spread in those communities, I'm afraid.
Schaffner says the end game at this point may be simply for public health officials to do as well as they can. Children as young as 12 can get the vaccine now, and officials expect that later this summer or fall, those as young as 5 may be approved. Without vaccinating kids, we'll never reach the goal.
It increases the opportunity to vaccinate, and the more people vaccinated, the better it is. Children are the great disseminators of the influenza virus in our communities, but their role in transmitting COVID is less certain. They certainly can, but I don't think they have the distribution franchise the way they do with influenza. Young adults, and by young adults I mean people in their 20s, 30s, and 40s, seem to be the great disseminators of the virus, the COVID virus, in our communities. And if we could get that population up to 80%, I think we would see a striking diminution in new cases.
However, for many, the hesitancy about being vaccinated may crumble. Some people's employers will require a COVID shot and can do so legally. For many people, the realization that you can live a pretty much normal life without a mask is a big incentive. Others will happily accept $100 in cash, or a gift card, or admission to a big-name concert. Ohio is offering a ticket to $1 million lottery for vaccination, and New Jersey is offering free beer.
It will take a variety of different things to, in effect, give them a lollipop of some sort after they're vaccinated as an immediate reward. And wouldn't that be nice? And that would certainly attract certain people. Other people really need to have their individual concerns addressed in a personal and sometimes quite persistent way over time so that they become comfortable and receptive to the vaccine, recognizing it. For example, it's a very responsible thing for an individual to do to protect themselves, their family, and their communities. Others need to be reassured about the side effects or the speed with which the vaccine was developed.
On that score, many people are surprised and reassured to find out that the vaccine wasn't as hastily made as they thought, that it's based on the SARS vaccine dating back to 2003. Others are having to readjust their expectations about the post-pandemic world.
I think there are some people who really thought that the end of the pandemic meant that the virus would be completely gone. And indeed, we had heard information from political leaders in the past that the virus might disappear. No public health person thought that. And now people are becoming more nuanced. They recognize that this virus is going to be with us over the next several years at least, and we will have to cope with it. So the question becomes, at what level are we, quote, quote, as a society tolerant of this virus in our community? We in public health would like to push it way down. Other people may not be that concerned and say, all right, most everybody else is vaccinated. I don't have to be vaccinated. My individual risk is pretty low.
Expectations can be a tough thing to overcome. Some people expect the COVID vaccine to be like those for polio or measles, which effectively wiped out both diseases. Schaffner says those vaccines were actually no more effective than the vaccine for COVID, but we didn't hesitate to get them.
Let's just talk about measles, which happens to be a virus that's even more contagious than COVID. So how did we achieve measles elimination in the United States? Well, we vaccinated all, or virtually all, of our children. We had vaccination rates that are above 90% and continue to be that. And notice that if we let up, there are communities where children hadn't been vaccinated, and a few years ago, we had importations of measles into those communities, and it spread. So the measles vaccine is a spectacularly successful vaccine, but not in the refrigerator. You have to get it into arms. And when we got it into over 90% of children's arms, then the disease disappeared. But you have to maintain that year in and year out. There's nothing magical about it. We could really diminish COVID if 90% of we adults were vaccinated.
However, Schaffner says that's not likely to happen.
Vaccinating children is a whole lot easier than vaccinating adults. We've never achieved 80% of vaccinating the adult population with any vaccine. So this striving for a very high goal is worthy, but we realize how much work it takes.
But it's far from just the hesitant who are still unvaccinated. Millions of those who would welcome a COVID shot simply have no way to get to a faraway vaccination site, or they can't take time off of work. The White House is offering free Uber or Lyft rides until the 4th of July to get people to vaccination clinics. But it may take still more to get vaccination to the point that it eliminates COVID as a threat. A long-term answer may be to take the same route as measles and polio and add COVID shots to the list kids need to have to get into school. Schaffner says it's already being discussed, but it won't happen right away.
This is an emergency use vaccine. It's not yet fully licensed, so governmental institutions, such as a school system, will not be mandating it. But private institutions can. And last I looked, there were over 100 colleges and universities that were going to oblige their students returning this fall to be vaccinated. They will have herd immunity on their campuses. If you get up to 95+% vaccinated, you can be very, very comfortable because your risk in that community is going to be essentially zero.
That kind of vaccine coverage is possible in a closed environment where you can mandate vaccination, but it won't happen in the general population. Herd immunity is unlikely. Even so, President Biden wants the nation as a whole to be up to 70% vaccinated in little more than a month, by the 4th of July. If we get there, how comfortable can we be?
I think actually pretty comfortable, particularly out of doors, where even if they then mix with unvaccinated people, the risk is going to be very, very low. I would still be leery of very large groups where people are close together for long periods of time. Indoors, I think we'll still want to be somewhat selective and careful. We can meet with small numbers of unvaccinated people, but we need to be cautious, especially those of us who are immunocompromised, where the vaccine won't work to 95% effectiveness.
Not reaching herd immunity means we can't completely forget the steps we took to avoid COVID before the vaccine. Our behavior can't go back to what it was pre-pandemic. For some people, the fact that the virus is still around, and likely will be for years, means that the vaccine has been less than a success. But Schaffner says we can't let the quest for the perfect get in the way of what's really good. The vaccine has saved many lives, and the vaccination campaign is far from over.
This race between vaccination and the virus is getting closer and closer. And I think as we add vaccinated people every day, the vaccine is catching up, and in many communities, I think, is starting to get ahead of the virus.
You can find out more about all of our guests on our website, radiohealthjournal.org. You can find archives of our programs there, as well as on Apple Podcasts, Spotify, or wherever you get your podcasts. I'm Reed Pence.
Cardiovascular or CV disease is the #1 killer of adults in the U.S., and millions of people trying to reduce their risk of a heart attack or stroke may unknowingly be taking medications that are not proven nor FDA approved to reduce cardiovascular risk. Let's hear from cardiologist Dr. John Osborne.
Many people are unaware that after a failed outcome study, the FDA revoked the approval of fenofibrates when added to statins, as the risk outweighed the benefits to heart health. It's important to remember that statins, along with diet and exercise, can lower cardiovascular risk by about 25 to 35%, but persistent cardiovascular risk, which can lead to a life-threatening event, may remain. I would tell anyone still being prescribed fenofibrates, such as Tricor and Trilipix, with a statin, to talk to their doctor about FDA-approved therapies for cardiovascular risk reduction.
To learn more and get clear on the facts, visit itscleartomenow.com. Again, that's itscleartomenow.com.
A recent survey of 2,000 Americans conducted by one poll finds that 98% of Americans think you need more protein than you do. The survey also shows that 55% worry they couldn't survive on a vegan diet based on the amount of protein they think they need. In fact, misconceptions about protein and plant-based lifestyles abound. Only 1 in 3 respondents know that 2 cups of cooked lentils is equal to the same amount of protein in a 5-ounce steak, according to Vegan Strong Assistant Director and Strength Athlete Danny Taylor.
Most people don't realize that plants have all the protein you need, yet many elite athletes are converting to a plant-based diet because it's helping their performance and strength improve dramatically.
Eating a whole food plant-based diet can meet your protein needs while being affordable and effective. Find out more at veganstrong.com. That's veganstrong.com.
Your brain will thank you if you don't watch too much TV. 3 new studies show that lots of time watching television in midlife may be linked to lower gray matter volume in the brain. In addition, researchers found as much as a 7% greater drop in cognitive function over 15 years. Kelly Petty Gabriel of the University of Alabama at Birmingham is lead author of one of the studies.
Previous studies have shown that exercise supports brain health, and now we know that types of sedentary behaviors requiring little thought, like watching television, may do the opposite. The amount of time spent watching television may be an important lifestyle modification to support brain health.
Gabriel says the level of exercise did not alter the lower gray matter volume linked to moderate and high levels of TV viewing. However, TV habits did not appear to impact dementia risk. The studies were presented at the American Heart Association's annual Epidemiology and Lifestyle Conference.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Remaining undiagnosed is really frustrating on a day-to-day basis.
Living with the uncertainty of a disease with no answers.
Then, to red meat or not to red meat. Find out what's wrong with the nutrition information you use every day.
Folks just throw up their hands and say, gosh darn it, I'm just going to eat what tastes good.
All that and more on Radio Health Journal.